Absolutely. I think there are, mixed evaluations of the Alberta Health Services Board, and I think what we've been able to do is take a look at what's working and what's not working based on a provincial level. We've been able to look at certain silos, meaning areas in the province of who's doing what better than other regions, and being able to take, pick and pull and put those in other areas to grow on those successes. What I think we need to do to improve on the needs of patients in Alberta is certainly to be collaborative and continue to be innovative in how we're delivering healthcare. We can draw from a number of examples around the world in terms of what works in other places, but we need to figure out how we implement those here in Alberta under an Alberta structure, basically finding an Alberta solution for our healthcare interests in Alberta. Certainly being a paramedic on the front lines for a number of years, has shaped my opinions of the healthcare system in terms we always need to be focused on patient outcomes. Working with my partners and my counterparts in EMS and other practitioners like nurses and physicians, at the end of the day, we're all striving for a positive patient outcome, bar none, regardless of the political winds of the day. So, for me, it's about patient outcomes and improving that. Is there a secret to the perfect healthcare system? First of all, I don't think that there is any perfect healthcare system. I think what we need to remember that, with human life, people have positive and negative experiences in the system, and of course that's how they're going to evaluate the system. But to ensure that the system is efficient, we need to continue to work hard for positive patient outcomes, and that's my commitment to Albertans. So the concepts that I think that we need to adapt that are going to be critical for positive patient outcomes in Alberta are certainly making sure that we're utilizing all practitioners to their fullest ability. We also know that in education and healthcare, it's evolving. There are far more practitioners in between a physician and a surgeon, and certainly the person that is actually accepting the person at admission in a hospital or a clinic. So we need to utilize them to their full abilities to educate patients and certainly ensure that patients are getting the right care at the right time and accessing it at the right place. My first-hand experience in healthcare has been a pleasant one. We've been very fortunate to receive very good care from my children and my family. I've had two parents that have had cancer. Unfortunately, my mother passed away, but my father is a survivor of it so far. And what our experiences have been, there's caring, compassionate practitioners in this province. They're all working very hard every day to see positive outcomes. And for me as an advanced care paramedic, coming to your home and being in your life at some of the worst times of your life, but also at some of the best times. I mean, I've been there when we've been able to deliver the first child. I've also been there to see parents as they pass on to the next life. And those are very personal, emotional things. And it's a privilege for me to be a part of that. But I do know, and what drives me to be an excellent MLA is to ensure that those outcomes are as positive as they can possibly be, whether it's a negative or a positive experience in healthcare. And so that reaches me on a deep level.